Good morning. My name is Andrea. I volunteered to make this video for you this morning because I wanted to give encouragement and support to those of you who are terrified of dental procedures and terrified of gum grafts. However scared you may be, it can't compare with the total hysteria I felt before my procedure. I had been told 15 years ago by my periodontist in Pittsburgh before we moved here that I needed gum grafts in parts of my mouth. I looked at him and I said, no way. I have heard all the stories. I think it makes people suicidal. I am not into pain. I'm not doing it. And when he would come in to do an exam, I'd look at him and I'd say, don't you dare mention it again. And he would back off, okay? This went on for 15 years. 2 years ago, we moved to Sarasota. I needed a periodontist. So I called the guy in Pittsburgh and I said, who do you know? He said, nobody. So he said, let me look at the directory. He got back to me and he said, Andrea, I don't know this guy, but he's got to be brilliant. He is double boarded in endo and perio. And he said, nobody's double boarded. So go see this guy. This guy was just in Craighead. So I came in and I met him. He was very gracious. He is a nice looking young man. He is very warm. He smiles. He has good patient interaction manners. And he took all these tests, and then he sits down and he says, you know, you really need grafts in your whole mouth. I said, what? The guy in Pittsburgh thought it was just over here and over here. He said, yeah, but that was 15 years ago. You didn't have it, so your recession continued for 15 years. So I had bad recession down here, bad recession up here. I looked at this guy and I thought, oh my God, I'm a cornered animal. Now they've got me, okay? So I'm looking at him with these wild eyes. And he's looking at me and he goes, well, it won't be so bad, you know. We have procedures so that it doesn't hurt. And I thought to myself, all you people lie. I know you lie. Doctors always lie about pain. Oh, it's just a little pinch. The hell it's a pinch, right? The hell is it? I said to him, yeah, it's not your mouth. So he laughs, and he says, some of the recession is so bad, I need to take the tissue from the top of your mouth. Oh, really? You're going to take a knife, and you're going to slice tissue from the top of my mouth? I said, you're crazy. We're not doing this. I said, what happens if I don't do it? Now, you can tell from this dialogue that Dr. Craighead is patient. He is sweet. He is kind. He has a sense of humor. I have a sense of humor, and I push back. And this guy didn't get mad at my pushing back. You know, this is not a perio who thinks he's God's gift to the dental world. He doesn't. In fact, he is God's gift, but he doesn't act that way. And I don't think he thinks that way. So he was very sweet. He said, well, okay, we could not do it, but you will gradually start to lose your teeth. And he said, you know, your parents lived for a long, long time, 98 and a half. He said, as old as you think you may be, you're going to be on this planet a while. And he said, if your teeth start falling out, you're going to have to wear false teeth. My parents had false teeth. In the jar by the bedside table. I'm not doing that. I looked at him, okay, all right. I went home, I was hysterical. Okay? Hysterical. I stayed hysterical for 2 months. Everybody knew I was a wreck. I was so agitated I developed an anxiety disorder. Now, I had heard tales like you've probably heard. You have heard tales too, right? Especially 10, 15 years ago. I stopped listening to tales because I wasn't going there. But 10, 15 years ago, oh my God, I had friends that said I'd rather die than go through that procedure again. I'm thinking, oh my God, he's cornered me. So I had to postpone it once because of travel. Oh, what a relief. Then I couldn't postpone it anymore. I had to do it. My anxiety went through the roof. Finally, my husband said, you can't live with this anxiety. This is ridiculous. Talk to the guy. So I called him up. I said, Craighead, we can't do this. Well, we got to do this. I said, Craighead, you can't take all that tissue from the roof of my mouth. He wanted to do the whole mouth in one sitting. I said, that's fine, but you can't take all that tissue. That's too much tissue. He said, oh, so we talked. And I said, listen, I know you can use cadaver. We talked about it when I first met him, and he said, it's not ideal. It doesn't take as well. I can use it, but it doesn't take as well. Your own tissue takes great. And I said, oh, dear. I said, no, look, I am a wreck, Craighead. I'm a wreck. You're going to have to use cadaver. Well, the poor guy has good psychological judgment, okay? And he realized this patient is going to be a problem patient if I take the tissue from the top. So he went out on a limb and he said, okay, I'll use cadaver except for 2 spots that are really bad. Then I said, are you sure it's okay? Because, then I realized I don't want to make the guy do something he doesn't want to do. I said, is that okay? He said, I would never do it if it wasn't okay. It's not ideal, but it'll be okay. Well, my anxiety went like this. I insisted on full sedation. You can imagine, you couldn't get me into the car to come here, people. Never mind put me under when I'm here, okay? I didn't want to know I was in the car driving here, okay? When I say terror, I mean, it was like facing the firing squad, okay? So he gave me a tranquilizer to take before, and he wanted to do the Lanap cleaning first, the ultrasound cleaning, deep cleaning. First we had deep cleaning. That wasn't too bad. Well, actually, that was 4 hours with the tech, okay, sitting in a chair. But that wasn't bad because I went to La La Land at my insistence. Then we did the Lanap, which is where he uses the ultrasound. Ultra laser. He uses the laser to clean out the pockets. I'm in La La Land. That's okay. Then came the big day. We're going to do the, we're going to do the grafts. Puts me in, gives me the tranquilizer at home. I get in the car like this. I can see, but I'm nice and woozy. We get here, the assistants and the nurses here are fabulous. And he had an OR assistant named Melinda who has since left. She was fabulous. She knew exactly how to handle me. I attached to her like a duck, okay? I knew Melinda said, don't worry, honey, I'll be there. As long as Melinda's there, okay, it's okay. They gave me the IV sedation. I come out. I feel fine. I said, when do we start? They said, we're done. Fabulous. I went home. They gave me pain pills. I'm not a pill person. I had no pain. I was so happy. I had no pain. The only thing that happened to me was they put this like rubber on top and the bottom to protect the tissue, right? Well, my rubber came out like 2 days later. It just came out. So I called. They're very responsive. I came in. He was out of town, but his wife, Christy, saw me. She was delightful. She said, you know what the problem is? Your teeth are very slippery and smooth, and it's not grasping the rubber. Okay, I put more rubber in. And I said to her, listen, I love your husband. I think he's the best. And I have no pain. I'm going to write him a thank you card. It is fabulous, no pain. She looked at me. Oh, really? I'm thinking, this is not a good sign. I said, yeah, why? She said, well, usually there's some. I'm thinking, oh. Okay, I go home. The 3rd and 4th day, I knew why she was looking at me funny. That's when the pain hit, okay? The pain hit the 3rd and 4th day. Now, it is not pain. On a scale of 0 to 10, 10 meaning you're going to take the bridge, right? This pain was like a 4 or 5. And I could handle it with the meds. But I did have that pain. The pain lasted maybe, I'd say it lasted 4 days. The roof healed about I'd say 2 weeks, it healed. I came in for my post-op, and I tell you the best part of this was seeing the look on Craighead's face when I showed him my gums. They were beautiful, beautiful, perfect, great healing. He was like, look at what I did. And I hugged him and said, look at what you did, Dr. Craighead. You're the best. He is the best. When I came in before the surgery for some of these pre-op appointments, the people who really know what's going on are the front desk. If you really want to know what goes on in a doctor's office, ask the nurse. Don't ask the doctor. So I asked some of the nurses, like casually. And 201, they said, oh, he is obsessive compulsive disorder. He is a perfectionist. He actually could drive you crazy with his perfectionism. He won't do anything that isn't 100%. He won't put his name on it, okay? So if he said he would do the graft with the cadaver, it's fine. Otherwise, he'd have sent you somewhere else. But he was willing to take it on, and I was the most troublesome patient I can even imagine. But at no time, and I said to him, I'm so sorry, I'm a pain in the neck. And he said, oh, you're not a pain in the neck. You're just scared, and you don't trust. Because doctors have lied to you in the past. Yes, they have. And he said, we're not lying. I told you you would have some pain, but it's not over the top. So I said to him, listen, I want to let some other people know 2 things. One, that dental medicine has advanced since the last time you talked to a friend who wanted to take the bridge over the pain. 2, that you can do it with sedation and you don't have to be a tough person and tough it through. 3, that you can have beautiful gums. I won't do this in the video, but after I had it done, I would see a friend on the street and I would go, you want to see my gums? And I'd lift my lip up. Look at them, aren't they beautiful? I was so proud of my gums. I still am. We did not do this for cosmetic reasons. We did this for medical reasons. And I think they're going to last probably as long as I last. But even if they don't, recently I said to Dr. Craighead, hey, listen, there's a little recession here that you couldn't fill in. Do you want to come back in and do it again? He looked at me like, oh my God, she's now inviting me to the party. When before she wouldn't go anywhere near me. She's inviting me. He said, well, I don't think we need to now. Let's just look at it in a couple of years. If we need to make some tweaks to it, we will. That, my friends, tells you everything you need to know. He is top notch. He is a wonderful person to deal with. He is kind, considerate, competent, great bedside manner, warm, responsive, reliable. And I'm a tough critic. If you haven't gotten that message listening to my voice, I am a tough critic. He's the best. Go ahead and trust him to do whatever he needs to do to stabilize your mouth. I hope this has helped, and I hope it brings you some comfort and some encouragement. Take care.